cardiovascular diseases. So in the case of cardiovascular diseases, what we have to study is regarding blood pressure. Then we have to study about arteriosclerosis, hemophilia, cerebral and pulmonary thrombosis. So these are the topics which are included in this section. Basically, what is a cardiovascular disease? Cardio means related with the heart. Vascular means blood vessels. So diseases which are affecting either heart or any blood vessel is known by the name a cardiovascular disease. And so it includes diseases of the heart and circulation, including coronary heart disease, which is like a heart attack. Then angina means pain in the heart, that is heart pain. Then heart attack, everybody know. Then congenital heart disease. Congenital means by birth. Sometimes in some babies there will be a hole between the right half of the heart and left half of the heart. Normally there is a partition is there. There is a right auricle and right ventricle, and there is a partition is there, or a wall is there. Similarly, between right ventricle and left ventricle also there is a partition. Sometimes in some babies, due to certain genetic abnormality, a hole will be seen, and that hole will be resulting in the mixing of pure and impure blood. So those type of diseases are known as congenital, by birth heart disease. And stroke. In the case of stroke, what happens is that any blood vessel that is going to the brain, they break or rupture, and lot of blood will be released into the part of the brain. When a lot of blood is present in the brain cells cannot function and they will get destroyed. And that is what is happening in the case of stroke. So we will see some of the major type of diseases. The first one is the thrombosis, cerebral venous sinus thrombosis. Here is the presence of acute thrombosis. A thrombosis basically means a clot in the dural venous sinus, because there we don't need to, it's that part of the brain which drain blood from the brain. So any kind of blood clot that is happening in this area is known by the name cerebral thrombosis. So I will show you some pictures of how cerebral thrombosis will be affecting the brain. Here you can see that. So this is what is happening in the case of cerebral thrombosis. See here, this is how it is happening. See. So here there is a clot is formed, and that clot is actually resulting in a lot of blood not going upwards, so that the blood, there will be a bulging or inflammation there, and after some time what happens is that the blood vessel will rupture. Here also you can see that. So this is the clot. After some time the blood vessel will be rupturing and the blood will be leaking into the brain. So this is how the cerebral thrombosis, see, this is the problem. So when there is some kind of clot is there will be bulging like this, and as a result of bulging, finally the blood will be leaked into the brain cavity, and that is known by the name stroke. So this is how the cerebrovenous thrombosis is normally taking place. And what are the symptoms that include? First, there will be headache, and followed by abnormal vision. If your brain is having some kind of problem, normally that will be affecting your vision, your hearing, your speech. All the activities which are controlled by the brain will be slowly affected one after another. To begin with, there will be headache. Then any symptom, so stroke, weakness of the face and limbs on one side of the body. That is one important symptom by which you can identify a stroke patient. If you look at a stroke patient, when you take a patient to a doctor, they will be checking the right side and left side very carefully. Now in a stroke patient, this right and left half will be working in a different way, and and their lips will be arranged also in a slightly inclined way or slightly tilted way. By simply looking at the lip or the arrangement of the lip, they can understand that the patient had a stroke. So that is the problem, that is the how the normally the stroke is diagnosed. So weakness of the face and limbs on one side of the body, because the brain has a design in which our right part of our body is actually controlled by left side of the brain, and left side of the brain will be controlled by right side of the brain. That is how the wiring of the brain has been done. That is why such a problem is there. Now, how we are diagnosing a cerebral thrombosis, and normally we are using a CT scan. I will show you that how we can diagnose a cerebral thrombosis, because they normally what they do is that, see, this is a CT scan, and this clearly shows that a lot of blood has been leaked here. So that is why this area is slightly white in color. So this is a major damage, as here also you can see that. See, this white area, this where yellow markings are, arrows are there. There all, the blood has been leaked there, and that will be damaging the cells around that. Here also you can find some areas of the brain are white in color. That shows blood actually. So the blood is leaked into that part. Here also you can find another. See, here also you can see that there is a leaking of the blood into certain areas of the brain, and that means that area may not be working. See, there is a very large stroke, and in this large stroke, the recovery of the patient may be much more less. But in a minor stroke, normally after 1 year, sometimes after 6 months or 1 year, most of the patients will be recovering if they are healthy and not very old. But in older patients, sometimes recovery may be very slow, sometimes may not be happening. So this is the case with the cerebral venous thrombosis. Now what they are doing treating with anticoagulant and rarely thrombolysis. I will also show how the thrombolysis. So thrombolysis, see, this is how what they are doing. They will be, see, here you can see that when we are applying some medications into that, and that will be splitting the clot. They are basically clot splitting. Here also you can see that there are certain clot digesting or clot dissolving medicines we will be applying. Most of the time that will be some enzymes. These enzymes will be capable of digesting the clot, so that the block will be gradually opened. Here you can see that. See, normally this is the blocked artery, and we are conducting a thrombolysis. By thrombolysis, this clot will be gradually dissolved. We will be using some enzymes, clot splitting enzymes will be used, and when the clot is dissolved, the passage of the artery is open, and there will not be any problem. So that is one way by which we are actually treating the block. Then we are also, here also you can see that this is how the block is gradually treated. Here it is a complete block, now gradually opened, and finally it is completely opened. So this is the mechanism by which we are undertaking the thrombolysis. And in the case of thrombolysis, it's actually enzymatic destruction of the blood clot, and The disease may be complicated by raised intracranial. Intracranial means inside the brain or inside the skull, which may warrant a surgical intervention such as placement of shunt. I will show you that how the shunt is actually placed in a shunt. See, placement of shunt. Okay. Sometimes the brain may not here you can see that. So this is actually how the shunt is actually a bypass system. See, this is a small tube which will be taking the your cerebrospinal fluid from the spinal cord and supplying it to the ventricles or cavities inside the brain. So this is how actually we have surgically inserted a tube. That tube will be taking the spinal fluid into the brain. Here also you can see that. So these are the cavities of the brain, which we call as the brain ventricles. Now, when there is some kind of problems are there, these ventricles may not be able to work properly, and in such a system you are using this kind of technology. Here we are inserting a tube into the ventricles of the brain. That is known by the name shunt, S-H-U-N-T, shunt. Basically, we are rerouting the flow of cerebrospinal fluid. So that is how the cerebrospinal shunt will be working. That is basically brain surgery. That is, brain has a problem, and with the medication we are not able to correct it. Then we will be cutting open the brain and putting a tube like that to transfer or divert the excess blood or bring the blood to that part. So such a system of bypassing the normal brain pathway or normal brain passages is known by the name cerebral cerebral shunt. So by shunt you have to understand that it is a bypass system, a rerouting system. So this is regarding the cerebrovenous sinus. Cerebral venous. Venous means basically venous blood. Then sinus. Sinus means a cavity, and thrombosis means a clot. A clot in the sinus or clot in the cerebral venous sinus. That is a major vein in the brain, and a thrombosis is taking place. Then we call it as cerebrovenous sinus thrombosis. So these are the cerebrovenous sinus thrombosis. Okay. Then what is now we go to the another area, that is the blood pressure. Now in the case of blood pressure, basically it is a pressure exerted by the blood on the wall of blood vessel. Here you can see that the pressure which is produced by on the wall of the blood vessel. I will show you a picture how the pressure is actually produced by the see, this is how the pressure is actually. See, this is a blood vessel. I will show you another picture. Okay, this is how the pressure is actually produced. So when blood is flowing through that, that will be applying some force on the wall of the artery as well as on the wall of the vein, and that force is known by the name blood pressure. So when blood is flowing through that, some kind of force will be applied. That force is actually known by the name blood pressure. Here also you can see that. So this is the blood pressure. Okay, so that is the meaning of the word blood pressure, the force which is applied or pressure which is produced or exerted by circulating or passing blood on the wall of the blood vessel. And here you can see that it is measured normally in a person's arm. You know how the pressure is taken. There is an apparatus which we call as sphygmomanometer. Have you seen a sphygmomanometer? Because every time you go to a doctor will be utilizing a small device like this, that is known by the name a sphygmo. This is known by the name sphygmomanometer. This is how the sphygmomanometer is normally taken. See, nowadays it is a digital system. Basically, this all there will be a cuff-like thing here, and doctor will be applying a cuff on your arm, and that cuff will be producing an air pressure. And what happens is that when air pressure is applied, it will be blocking your pulse, and that pulse can be dictated by placing a stethoscope here. So that is how the doctors will be normally checking. Normally the pressure will be in a normal patient, it will be 120/80. That is a normal pressure. But any kind of variation from this, for example, in this case it is less, and that is known by the name hypotension. If it is more like this, for example, here you can see if it is more, we call it as hypertension. So there are two situations in blood pressure. One is known as hypotension, and the second one is known by the name hypertension. Hypertension simply means a higher blood pressure, and hypotension means a lower blood pressure. And normally it is expressed as like this mm of mercury, because nowadays we are all using digital system, but earlier actually we are using a traditional system like this. I will show you. This is the traditional system. So this is not here. It is using a mercury, just like in a thermometer. You can see a mercury. The same mercury is flowing here. Here you can see that. So this mercury, this based on the number of units mercury is occupying, we are telling the units of pressure also. So earlier mercury was used. Nowadays also mercury sphygmometer are common, because sometimes doctors say it is far reliable, because when there is a digital thermometer, digital machine, sometimes there can be minor variations also. So this is regarding the blood pressure. Blood pressure is normally indicated as 120/80. 120 is the maximum pressure. What is systolic pressure? There is a term called systolic pressure. I will show that also. In this of a systolic pressure, so this is how the systolic pressure is taking place. See, normally when your heart is undergoing a beating or contraction, there are two areas for the heart. One is the upper area, which we call as the auricles, and there is also a lower area which we call as the ventricles. Here, this is our better picture. So these are the auricle, and these are the auricle, and the lower one is the ventricle. This contraction of the upper part is known as systole, and the contraction of the upper, the contraction of the heart, contraction of upper as well as the lower part together is known as systole. And similarly, there is a relaxation, and that relaxation is known by the name diastole. This is the diastole is referring to the relaxation. This is the diastole. Diastole simply means the relaxation of the heart. See, this is the diastole. When diastole is there, the heart will be shrinking and the pressure will be low. So when during the diastole, here also this is the diastole. See, here you can see the heart is slowly shrinking and the pressure inside the heart will be low. So that is how we are expressing the blood pressure. When during the contraction of the heart, it will be higher, and we call it as systolic pressure or maximum pressure, and during the relaxation of the heart it will be lower, which we call as a diastolic pressure or minimum pressure. In a normal resting person, that is the person is not doing any much activity, just sitting or listening or simply lying, then in such a situation this is the normal value. On the other hand, you are running for a long time, you are climbing steps, then if you take your pressure, there may be slight variation. So this is how in a normal resting person the pressure will be. The higher limit will be 120 and lower value will be 80. Higher value is known as systolic pressure and lower value is known as the diastolic pressure. Then another point about the pressure is that the pressure has two situations. The pressure is lower than the normal range, we call it as hypotension. If the pressure is is higher than the normal range, we call it by the name hypertension. Hyper means more, hypo means low. So one is low pressure, other is high pressure. Now, in the case of both cases, there can be some difficulty, but more difficulties are commonly present when pressure is increasing. See, long-term hypertension is a risk factor for many diseases, including kidney failure. Now, I will show you how pressure is affecting your kidney, because what happens in the case of kidney is that see, here you can see that how hypertension will be damaging your kidney. See, the kidneys are actually formed of thousands of smaller tubules known by the name renal nephrons. We call it as nephrons. And what happens in the case of this kidney is that these renal nephrons will be slowly damaged. Here I don't know, there is a good it's no good picture. The renal nephrons of the kidney or the nephrons of the kidney will be slowly destroyed by high pressure, because if you are pumping very high pressure water through a normal pipe, for example this is a normal pipe, and we are pumping very high pressure to that, what will happen? The pipe will be breaking. The same thing happens in the case of high pressure also. When we are pumping blood at a higher pressure, our kidney vessels or kidney tubules, which are very small, will be damaged. These tubules will be damaged, and that damage to the tubule will be ultimately resulting in the damage to the kidney. And that is what is happening in the case of hypertension. Hypertension basically results in damage to the kidney, and we call it by the name kidney failure. That is kidney failure. That is, kidney is not working. Then what we will do? Because normally when most of the dying patients will be having this problem, the kidney stops working. So when kidney is stopping working, if it is a healthy person or a younger person, what doctors suggest is that you replace the kidney with the kidney of another person. That is one method. Or another method is that you can use a daily dialysis. In the last class, I think we have discussed about dialysis. So conducting dialysis every day is one possibility. Another possibility is that we have to completely replace the damaged kidney by kidney from another person, and that is known as kidney transplantation. So about kidney transplantation, nowadays we are hearing a lot of complaints from different hospitals. You can also see in TV also. So because this kind of problems always there, when people have a lot of money, they will go for every crooked pathways to extend their life. So that is what is happening in here also. Then, so long-term hypertension is more common than long-term hypotension. So basically, the problem with the higher blood pressure is that damaged kidney, then it can lead to heart diseases also. It can also damage your heart. Then it can lead to stroke. I told you what is a stroke. Stroke means blood will be leaking into your brain. So that is happening in the case of stroke. Then so the best thing by which we can control, because anyway, with regard to in our normal, if you take the lifestyle of our people, majority of the people after an age, for some people after 40, for some people after 50, for some people after 60, they will have this problem of higher blood pressure. So it is just becoming a routine problem. There are very few older people who don't have a pressure problem with the pressure. Anyway, controlling the pressure is always very important, because if the pressure is not controlled, it will damage kidney, it will damage your heart. So what you can do is that after a while we have to regulate our salt intake, because salt is an important factor in increasing pressure. Normally a healthy person can take about 8 grams of salt per day. So that is okay for a healthy person. But when you have a blood pressure, you can only take 2 grams of a salt. So that means we have to reduce about by 75%. So minimal salt, that is one way by which we can reduce the pressure. Another method by which we can is the daily exercise. Daily exercise, maybe every day we have to walk at least 30 minutes. So that is another method by which we can control our blood pressure. Then certainly if the pressure is not remaining stable in our normal range, we have to go for medication. So that is the only method by which we can control the blood pressure. If pressure is not controlled for a longer time, then it will be complication, creating a lot of complication for you. So it is nowadays the people are more aware. Most of the people after an age of 40 are undergoing regular checkup, maybe once in every month, every year. So that if there are any problems with our body, because just like any vehicle, it has to be serviced. Our body has to be monitored and serviced after certain years, because we are getting older. So that problem comes, we have to monitor the health, and we have, especially pressure is an important thing. I think today we will stop here. Then there is another topic which we call as arteriosclerosis, about which I will discuss in next.